Hello, I'm Robert McMullen. I'm a psychiatrist who's been treating people mainly with psychopharmacology medication for over 35 years. And now I'm using TMS, transcranial magnetic stimulation, in addition to that. I went to Georgetown Medical School and Columbia for psychiatry. And I want to talk about GAD, which is short for Generalized Anxiety Disorder. Now, this is a relatively common disorder that 3% of the population has it now, and 5% of the population, 5% of us, 1 out of 20, is going to have it at some time in our life. And maybe when we have it, maybe it'll just last a few months or a few years and then go away. But 1 out of 20 has it at some time in their life, and about 1 out of 30 have it right now. And if you go to a primary care doctor's office, about 1 out of 12 of the patients sitting in his office have generalized anxiety disorder. So they go to the doctor a little bit more often because they've got more worry and anxiety. Now, generally, people with GAD worry all the time, and they worry either about little things or big things, and in my experience, both. They worry about what's going to happen tomorrow at work. They worry about an exam they have to take in a week. They worry about what they're going to do when they see some friends after school or after work. They worry about what they're going to do with their career. Now, they might be a year and a half at this job, and they may feel that it's appropriate to perhaps in another year and a half seek another job and try to go up a little higher in the ranks. And rather than once a month sitting down with his wife and discussing the long-term ideas of how they are going to save money and decide if he's going to apply for another job, he worries about it every day. He's thinking about it every day and torturing himself when he doesn't really have to make a decision for a year and a half or so. And it's a very uncomfortable disorder. Now, it's can be confused with a number of other problems which I want to mention. Depressions. If somebody's chronically unhappy and depressed, and depression fluctuates, a lot of them are anxious all the time. And when they are even briefly in a normal mood, usually the anxiety evaporates, and therefore they don't have generalized anxiety disorder. Substance abuse disorders often have a lot of anxiety, partly because they're in a little withdrawal all the time, or the substance they abuse is making them edgy and hyper. Some psychotic disorders like schizophrenia can cause severe anxiety. I treated one fellow with severe schizophrenia, and the family just begged me to treat him because his depression was so severe, and it was just difficult to live with him, and he was a torture. And I was reluctant. Finally, I did, and it worked. His depression was gone. It was hard to treat him because he was so miserable. He'd be moving his head around, so it's hard to keep the magnet in the right place. And he was worrying about all sorts of bizarre things, that his foot was going to fall off when he walked down the street and so on. And his depression went away, but his anxiety didn't. And his depression stayed away for a few years. And his massive anxiety continued. I did some more, and now if I had it to do over again, I might do a lot more. There's a way of treating with TMS where you do an inhibitory treatment here. And Dr. Wang in Beijing, China, just published in a major journal using the same treatment instead of here in the forehead, on the parietal lobe back here, and that it had a significant benefit for both anxiety and insomnia. And they did it double blind. Half of people got the real treatment, and half of people got a fake treatment that feels just the same. So you can use TMS for anxiety disorders, but there's not a lot of literature on it, not a lot of proof yet. Now, another anxiety problem that happens is agoraphobia, a fear of going places, even though the person doesn't have many panic attacks. So they get very anxious going into a crowded elevator or sitting in the middle of a crowded theater. But that's a different disorder, and that's more related to panic disorder. Panic disorder is also very common. It's currently about 2% of the population, 1 out of 50, has it, and the lifetime prevalence is 2% in men and 5% in women. And this is having an acute attack of anxiety, which we call a panic attack, where you get short of breath, you feel like you're going to die, your heart's racing, you get cold sweats, and it's just a horrible experience. It just lasts a couple of minutes or more, but it's so terrible it feels like it lasted 20. And a lot of those people are anxious all the time in between attacks because they never know when the next attack is going to come. But that's not generalized anxiety. Now there's post-traumatic stress disorder, has a lot of anxiety, but it also has a lot of depression mixed in there, and they have flashbacks to the trauma, they have nightmares, they have a different cluster of symptoms. Obsessive compulsive disorder, where people have to do certain things. Some of it is obsessive thinking, some of it is obsessive behavior. Like, I have to wash my hands for an hour or I may contaminate my family. And those people are often anxious because they're worried they haven't done enough obsessive compulsive behavior to prevent bad things. And then there's social phobia. And these are people who get extremely anxious around other people. And I treated a fellow a while back who I know very well, a Hasidic man who went on to get a couple of master's degrees, which is unusual in his community, and is quite a smart fellow. But he really suffers from mood swings and depressions. And so I gave him TMS, and this may be just a fluke. But when it was over, he said, my social phobia is gone. I said, what social phobia? Because I didn't really know about it. Because in his community, everybody lives close together. They know each other from shul and from being in yeshiva together. But he actually had massive social anxiety. So when he would go to shul to pray, he didn't schmooze with other people. He didn't talk. He never had a close friend. And because he had so much social anxiety. And I didn't realize this because he's very comfortable with me. And for some reason, the TMS treatment made it virtually disappear. And he just stopped having all of this anxiety. And 2 or 3 years later now, it's still just a minor problem in his life. It's no longer. But that's not we haven't found a TMS treatment that's going to definitely do that. I think I got lucky. Now, why treat this generalized anxiety disorder? Well, one thing is because the people are suffering. But also, you have to think of a few other things. Say you have an alcoholic woman that's a mess, and she's drinking all of this alcohol and has lost her family, her friends, everything else, and she's in terrible physical health. The best way to treat her is to treat her anxiety disorder when she's 12 years old. These anxiety disorders start when very young, and when they have their first drink, frequently they feel, my God, finally I'm normal. Because alcohol really takes away the anxiety of generalized anxiety disorder and also a panic disorder and other things. And that's part of the reason it's abused so much. I had a patient that I got in a little trouble with because she had severe panic attacks. She was over 50 and had been on high doses of Xanax for 20 years. So I continued to give her a very high dose. Xanax is alprazolam. It's one of the benzodiazepines like Valium. And the advantage of Xanax is it makes people less sleepy, and it has more antidepressant effect. It's the only one that has antidepressant effect, and you can find that in a Cochrane report. So she had a little party, and after the party was over, her Xanax was gone. And somebody who was in her apartment at this gathering took it and left with it. This was halfway through the month. So I said, you got to come over here right away and we'll find something to substitute, because the pharmacy wouldn't give her a different benzo because she had just filled this 2 weeks before. Now, she'd been taking these for 2 months, never took it early. I know she wasn't abusing it. And she didn't come over. And now I'm thinking, maybe it was because without the Xanax, she was too panicky. She had severe agoraphobia without it because she just couldn't leave the apartment. So, to make a long story short, she had to move to a different part of the city for economic reasons, and another psychiatrist was treating her. And I talked to her on the phone, and they would only give her a tiny amount of Xanax per day, 1/10 of what she was taking before. And a psychiatrist came to her apartment to see her because she couldn't leave the apartment because of her severe panic attacks. And she says, so what I do all day is I sit here and I drink a bottle of vodka a day. It's the only thing that controls my panic attacks. And she was much better off on the Xanax. Xanax has a very bad reputation because of the fact that it has a lot of withdrawal. And if you're on a fairly hefty dose and you stop it suddenly, you've got a good chance you'll have a withdrawal seizure the next day. Whereas with the longer acting ones like Klonopin, which we prefer, clonazepam, Klonopin, or lorazepam, which is Ativan, and so on, those are much longer acting. So if you stop them abruptly, you might go back to your old anxiety a little fast and be maybe more anxious than usual. You may have some withdrawal, but you're not likely to have a seizure because they take so long to wash out. But this woman was better off on the high dose of Xanax than she was on a bottle of vodka per day. Similarly, I had a lawyer who was on methadone, and he'd been on it for 30 or 40 years. And what had happened is when he was in his teens, he had such massive anxiety that he couldn't bear it. It was torture. And he looked around and he tried different things and nothing helped. And then he thought, well, narcotics, they're probably going to help. And he went and took some narcotics, and sure enough, the anxiety evaporated. So in a few months, he managed to obtain enough narcotics so that he could convince a methadone clinic to treat him. And on the methadone, he was fine. And for the rest of his life, he stayed on it, and it controlled his anxiety. And if he reduced it too much, the old anxiety would come back. At least 50% of all people that are drug addicts actually had a psychiatric disorder before their addiction. That they had a depression, or they had panic attacks, or they had some other anxiety disorder. And if you're spaced out on medicines, whether it's alcohol or marijuana or cocaine or almost anything, you feel better than you do when you usually feel better than when you're in misery from the depression or anxiety. Now, behavioral treatment for generalized anxiety disorder works fairly well. It's cognitive behavior therapy, and in perhaps 50% of people, it'll have a major benefit. And it is sometimes onerous. You have to go there weekly and work hard at it, but that's a pretty good, pretty high degree of relief, 50%. And then if people relapse, they can sometimes on their own use the tools that they learned in therapy to alter their anxiety back to a more normal level, or they could just go have touch-up treatment with the same therapist or a different one. Now, the medications that have been shown to work for generalized anxiety disorder are the following. Buspar or buspirone. This is a wonderful anti-anxiety agent. I call it an invisible medication because you don't feel like you're on anything. And if you're on it for 3 years, 30 milligrams a day is the usual standard dose, and you suddenly stop it, you don't feel any different. You don't say, oh my gosh, it was making me tired, or it was giving me a dry mouth. And then, in my experience, about 10 days later, the old anxiety begins to come back. And I always warn people about this because they stop it and they feel fine. And then, a week and a half or so later, when they're starting to get anxious and worried again, then they think, well, the reason I'm getting anxious and worried is for real reasons. I just had this problem with my spouse or my kids, and this is causing it. It's not because I'm off the Buspar. But it's actually the Buspar can lose its benefit. Now, I had one fellow who was a lawyer, and it was torture for him. So I don't know if he has a GAD exactly, but maybe. It was torture for him to pick up the phone and call the opposing lawyer to discuss the case and try to have a settlement or something. It was just torture and painful. And when we put him on Buspar, it changed. He could just sit down, pick it up, and talk and do it. And then after about a year, for some reason, we decided to stop it. And when he came off of it, he was still okay. He learned he could do it, and so he could continue making the phone calls without excessive anxiety. Other medications that have been shown to work are Effexor, which is venlafaxine. It's a serotonin medicine that's a dual-acting antidepressant, somewhat like Prozac and Zoloft. Stelazine had a positive study, but all the old antipsychotics, Stelazine, Haldol, Prolixin, Thorazine, Perfenazine, all of those medicines are toxic to brain cells. And so we've been giving people with schizophrenia these medicines for years, and it's been killing off their cells. And I remember long ago people talking about how the ventricles of the brain, fluid areas in the brain, were expanding when people were on higher doses of these medicines. And then Some people would say, well, it's because they're killing cells. And then other people would say, no, the person's on a higher dose because they're more mentally ill than someone else, and that's why their brain tissue is breaking down, is because they got a worse illness. But now the basic scientists have proven that these old medicines actually do kill cells. And all the new ones, starting with Risperdal, actually are good for the brain. They preserve brain cells, they protect them, they probably contribute to protecting from Alzheimer's. The new ones are Risperdal, Abilify, Seroquel, Rexulti, Vraylar, and I'm sure I'm leaving out a couple, Safras. And then benzodiazepines work, such as I mentioned. Xanax is often really the best, but there's this problem with withdrawal, and also a lot of high school students abuse Xanax. They take it with alcohol, and for some reason it gives them a different kind of feeling of drunkenness, or maybe they get more blackouts, or they I don't know, they find it more attractive getting drunk with this. And so we kind of avoid it for those reasons, because you never know who's going to, like my patient, run out of the medicine, and or they're off on a trip and they run out of it, and they don't realize they should take some Klonopin or Valium, something else, to prevent the withdrawal. And then tricyclics, the old antidepressants, they work. They have a little trouble sometimes with dry mouth and a little weight gain. There's a few cases of gabapentin, Neurontin, that's an anti-seizure medicine, helping. And then the newer antidepressants, the serotonin medications like Zoloft, Prozac, and so on. One of the problems with the serotonin medicines is sometimes they poop out over time, especially if you're using it for depression, so that a few months later, or even 10 years later, they've just stopped working and you went back into your depression. And sometimes they make people flat, where they just don't have an edge of excitement about things.